Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. In this video, I'm going to be talking about a tough subject, especially because it involves patient comfort and even dentists and dentist longevity and maybe over longevity. So it is a tough subject to broach, and I do have to do so because of concerns. So first thing first, so if you are a patient and as a patient, you always want to have somebody who's had some experience. You don't want the newbie. And I know that some people are open to new folks and new ideas and everything. And young dentists have to learn too, and they have to get their experience. So I'm not saying this is something bad for new dentists, but as a general patient, as your average Joe patient, Jane patient, whomever it is, you probably want to have somebody with a little bit more experience, I would imagine. So that's kind of your average person. So it's great to have somebody with some experience. But if you look at your dentist and you're wondering if they helped George Washington cross the Delaware, that might be a little bit of a concern. So while experience is good, if you kind of are watching them move and you're concerned about how much they can see or how well they can maneuver, then that's an issue. And again, this is a very tough subject to broach, but I've just kind of seen this recently and heard about recently with somebody who was treating my mother, for example. And I remember he treated me when I was 17, but that was nearly 3 decades ago. So when somebody who's already in their 50s is kind of doing that again, and was having some trouble treating my mother, that became a concern for me. Because I can't tell you if the hand skills or the eye ability to, see, perceptual ability, depth perception, etc. I don't know if it's all there when somebody who's practicing is reaching their 80s or 90s. I'm going to tell you right away, I don't want to reach my 80s or 90s and still be working. Again, personal subject, but I know that at that point, my hands are not going to be as good as they are now. My eyes are not going to be as good as they are now. I'd love for that to be the case, that they were as good, at that age as they are now. But let's face it. Let's face reality. It's not going to happen. So again, if you have a dentist who is, seasoned, or you might be suspecting over-seasoned, then maybe consider a second opinion. And I know it's hard. Again, it's hard to switch dentists, especially if you've been with somebody for 20, 30, 40, 50 years. It's very difficult. It's very challenging. If you've known the person for your entire adult life, like 50 plus years, it's horribly challenging. But again, I've experienced it where people are telling me, oh yeah, been my dentist for a really long time, but I know he messed up in my mouth twice. That's a concern. That's a real concern. So that becomes a concern for patient safety, for things that are going on in the mouth. That's a huge concern. So that's one thing. Now, part two, I will address the, over-seasoned dentists maybe, depending. I mean, everybody's going to know or not know when it is time to walk away from the profession and be done and retire. But again, let's face it, do an honest evaluation of your hand skills and your eyes. If you are having trouble moving, if you are having trouble moving your arms, moving your hands, things along those lines, if you cannot see, if you're having trouble even locating where you need to work, be honest. Just be honest with yourself and say, hey, look, maybe I can't do this anymore. Again, your patient's safety, how well things go for their overall health and their mouth's health really is number one. So if you don't think you can deliver the same care that you delivered when you were in your 40s and 50s and even in your early to mid 60s, I mean, I even say that up to the mid to late 60s, you're probably still going to be 100%. I'm going to tell you that. I think that that's the case. After that point, though, it starts to come a time where you're not going to be 100%. You're not going to be able to make the right decisions based upon what you can see and what your hands can do. I really don't think so. And maybe there's that exceptional person that can, but the vast majority are not going to be able to do that. So I am going to say reevaluate your abilities, reevaluate your hand skills, reevaluate your eyes, and reevaluate your ability to clinically determine what's right and what's not. These are all really important things. Again, tough subject to broach. And I know I'm going to get a lot of flack where some older dentists are going to tell me that they're perfectly fine and that everything is hunky-dory. But I'm going to tell you, based upon what I've seen recently in a number of cases that came through in my practice, that maybe some people should have retired 5, 6, 7, 15, 20 years ago, because I'm simply not seeing things that are clinically acceptable. And so, won't name names, but, it becomes a concern when harm is being done to people's mouths, and that even the patients themselves will come out and tell me, yeah, I know he messed up in my mouth once or twice minimum. So that said, tough subject. Thank you for joining me on this. And again, I expect to hear, some criticism, but I'm just advocating for patient safety in this case. Okay, for your patient's well-being, the people that you cared for, that you would love to do a great job for, and maybe you're just not able to anymore. And that's okay. That's a part of aging. That's a part of life. So you need to be able to recognize when is enough, when to say when, back out and make sure that somebody else who can do a good job is going to take care of your patients. Just please consider that. Don't do a knee-jerk reaction. Oh, what a jerk. He's trying to kick us old people out the door. I'm not. I just don't want people to get hurt. So that's it. Thank you so much for joining me. And I hope you're all staying well and healthy.